Welcome back to Catalyst University. My name is Kevin Tokoph, and in this video, we're going to be talking about best practices for strengthening the spinal erectors, and in general, the paraspinal muscle group on the backside. Most of the emphasis here is going to be on the low back region, but understand that strengthening the thoracic region of these muscles, you pretty much apply the same types of exercises. All works pretty much the same way here. Now, within the paraspinal muscles, there are two big ones that we're concerned with. Number one, which we'll get to a little later in the video, is the multifidus. That singular multifidi is plural. And it turns out that weakness in the multifidi correlates very strongly with recurrent chronic low back pain. Very important to remember that. And the second one is really a muscle group. It's the erector spinae. And within erector spinae, there are three muscles. The first one is in red here, iliocostalis. It's the most lateral of these. It originates off of the common erector spinae aponeurosis, and it extends upward to insert on the ribs above and the transverse processes of some of the vertebrae above. Won't get too much into the specifics, but that's how the muscle is positioned. Medial to that in blue, we have longissimus. Longissimus originates also from the common erector spinae aponeurosis, and then also the spinous processes of the lumbar vertebrae L5 through L1. It extends upward and inserts also on some of the ribs above and also the transverse processes of the vertebrae above. Very similar to iliocostalis. And then the most medial in green is spinalis. That originates off of the spinous processes of L3 up to T11, and it inserts on spinous processes at levels above. Collectively, the erector spinae muscle group, no matter which portion of it is, where it originates, where it inserts, these serve to extend the low back. So if you're slouched like this, extension of the back up like that, that is the job of this muscle group. The other thing this muscle group does is it helps to stabilize against excessive lumbar flexion. We've all seen these videos of these people with absolutely god-awful deadlift form that is honestly unreal that they don't injure themselves doing this. But if only they had stronger spinal erectors, they would be able to guard against that excessive lumbar flexion and be able to keep the spine a lot more neutral. A lot of people like to think it's the core muscles, the transversus abdominis, and all those other anterolateral core muscles. Those are responsible for it. They do play a huge role in abdominal pelvic stability and spinal stability, but it's the spinal erectors, these right here, that are preventing the spine from going into excessive lumbar flexion, keeping the spine as neutral as possible during some of these lifts. These are really important in a lot of heavy lifting, and they tend to be a commonly neglected muscle group, not only in people going to the gym and general fitness, but also from a physical therapy perspective. Then we move on to talk about the multifidus. Remember, plural is multifidi. But here is a systematic review, the role of the lumbar multifidus in chronic low back pain. And what they found here is that the lumbar multifidus muscles, they're important stabilizers of the neutral zone of the low back. That's the part of the low back where everyone focuses on keeping it neutral during, let's say, a deadlift or a heavy lift of some kind, right? And dysfunction in these muscles, aka weakness and fatty infiltrations, are strongly associated with low back pain. Furthermore, muscle training directed at teaching patients to activate their multifidi in the lumbar region is an important feature of any clinical approach to low back pain for a patient that demonstrates multifidi dysfunction or atrophy. Now, there are no isolation exercises for the multifidi, okay? If you want to strengthen the multifidi, you need to do one of two types of movements. The first is going to be the topic of this video, and that is doing exercises to strengthen the erector spinae muscle group. You cannot do these lumbar extension movements, or at least exercises that stabilize against lumbar flexion. You can't do those without the multifidi activating. So multifidi are going to get stronger if you do those types of movements, which, like I said, tend to be deficient in a lot of people's programs, both in the clinic and in the gym. The second way has to do with this other study that they did. This is recovery of the lumbar multifidus muscle size in chronic low back pain patients by strengthening the hip abductors, gluteus medius and minimus, a randomized clinical trial. They found that abductor strengthening is effective in the size increase of the lumbar multifidus muscle thickness that is commonly reduced in people with chronic low back pain. What this essentially means is that if you go back to the video that we had over strengthening the gluteus medius and minimus, those lateral hip muscles, and do those types of exercises, the multifidi will get stronger. So a great example that you can see right here, again, we cover this in other videos, would be a deficit reverse lunge. And technically, you don't even need the deficit. If you've got a low-level individual, you can have them do a reverse lunge and just not even do it from a deficit and not even do full range of motion if they can't handle that at first. You could even do side-lying hip abduction. You could do some standing cable or banded hip extensions or abduction. Those will also hit the multifidi, okay? But you can also get more advanced. You can do reverse lunges. You can do B-stance RDLs. Anything like that we talked about in that video will suffice. So those exercises, and then also lumbar extension-based exercises, which is what we're going to get into right now. However, before anyone starts embarking on a lot of these exercises to strengthen the paraspinals, many of which involve a hip hinge type of motion, it behooves one to make sure that they can do a hip hinge in the first place. And so a really good drill to do that is a dowel hip hinge. So you're going to be standing like you see here, feet shoulder width apart, and I've got some kind of stick on my back. Does it matter which arm is on top and which is on bottom? No, it doesn't. It's just whatever is most comfortable. That makes no difference. But you want to keep 2 points of contact with the stick the entire time. One point is the upper back, maybe around the region between the shoulder blades. And the second region, for lack of a better phrase, is the top of the butt crack. If you don't keep those 2 points of contact, what you tend to see is the bottom portion of the stick at the butt crack comes off. And that results from excessive lumbar flexion. So in order to keep those 2 points of contact, your spinal erectors have to engage. And they have to engage well to be able to go through that entire hip hinge range of motion without the stick or rod or dowel, whatever it is, coming off of the back. So if you can do 15 of those pretty well, you're probably pretty good at hip hinging, and you can probably default to some of the other exercises we're going to see in just a minute. I also want to show this other variation, which is going to be a little better for the multifidus, if that's where the person's level is at. And that is doing so with B-stance. We talked about B-stance in other videos. That's essentially where you have a working side foot. Here's the heel of that foot. And then the toes of the other foot line up with the heel of that one, okay? So the working side in terms of glutes and hamstrings is the side that's in the front, okay, where 80-90% of your weight is. But when you do it this way and you hinge forward, we have a little bit of rotational torque at the low back. And in order to stabilize against that and prevent that excessive rotation as we're hinging, the multifidi are going to be forced to contract. You can start to see how we can maybe get a little more multifidus activation in some of these spinal erector exercises, taking some of these into more of a B stance, something that gets more gluteus medius and minimus. But I digress. I would start with making sure a person can do both of these. If they can do them well, there's no sense in lingering on these. But if they have trouble with these, it's a good idea to perfect these first before moving into some of these other exercises. And that being said, we're moving into those right now. Exercise number 1 is a conventional deadlift. Now, the conventional deadlift is different than an RDL in the sense that the conventional deadlift starts with the bar on the floor, and it forces you to have a lot of strength and power to get it off of the ground and bring it up to the top. In order to prevent your low back from caving into this curved lumbar flexion, your spinal erectors have to contract very hard to stabilize your back in a neutral position. If you have a person who is not able to maintain a neutral spine when deadlifting, and granted, neutral spine isn't everything, but if you've got a ton of excessive rounding, excessive lumbar flexion, like that clip I showed you at the start of the video with that ego lifter, it's very possible that at that particular load, there is not sufficient spinal erector strength to keep the spine from caving in like that. And yes, there's an anterolateral core requirement, of course, but spinal erectors, very important there. So one solution could be, well, maybe the guy's just ego lifting and needs to lower the weight. Fair enough. But if a person, even at a pretty low weight, is not able to do that, spinal erectors, that's where they need to go. And so you want to pick a weight on the conventional deadlift where they can keep the spine neutral. And as long as they're doing that, the spinal erectors are working isometrically, but they're also working very hard in that manner, and you can get some really good strength gains out of those by simply doing a conventional deadlift. But when you do that deadlift, keep the spine neutral, because that's what's going to keep those paraspinal muscles working very hard, okay? You can also do this with an RDL. However, I would make an argument that for paraspinal specifically, conventional deadlift is better. Exercise number 2, good mornings, glute biased. Good mornings, some people think of as a glute exercise, and yes, they work the glutes, but I think of this more as a spinal erector strengthening exercise because the bar is loaded just below your neck, probably around the spines of the scapula. And because of that, the spine is experiencing a humongous axial load, especially as you hinge down. So because the spine gets a huge axial load from the placement of the bar, the paraspinals are having to work exceptionally hard here. And even though they're working isometrically rather than dynamically, the amount of stimulus they're getting is phenomenal. Good mornings, I would say, are my absolute all-time favorite spinal erector strengthening exercise. If you feel your low back muscles working here, you're doing it right. A lot of people say you shouldn't feel it in your back. I mean, you shouldn't feel pain in your back, but if you get DOMS or you just feel at the time your spinal erector is working in the lumbar region, there's no issue with that. This is a spinal erector strengthening exercise. If you're looking for glutes, there are much better ways to do it. But for spinal erectors, absolutely hit up your good mornings. Phenomenal exercise. Exercise number 3, Roman chair hyperextensions. Some people online will say, oh, this is not a back exercise. It's bad to do that. That is utter BS. I mean, you can certainly do this for hamstrings. You can do it for glutes. But by allowing a little bit of lumbar flexion as you go down to the bottom and then extending a little bit up as you go to the top and progressively overloading this, absolutely phenomenal for the low back muscles. A lot of people need to get them stronger. This is one way you can do that. You can certainly hold a weight in your hands. You can even, as I'm showing right here, put a barbell behind your upper back and load it that way. There's a lot of different ways you can do it. The only thing I would say, if you're loading a barbell in this manner, just make sure you have a good way to bail, okay? I've got safeties up for that reason. You don't have to do it that way, but just make sure you have an easy way to get the bar off, or you're using a spotter. But if you don't have either of those, just hold it in your hand across your chest or just hang it down there. Great for strengthening the spinal erectors. But when you're doing it for those, you want to make sure that you are allowing a little bit of bend at the bottom of the back and extending, arching a little bit up at the top as you go. The reverse of that movement, number 4, reverse hyperextensions. This machine is typically thought of as a glute exercise, and it does get the glutes. But oh boy, this one is really good for the spinal erectors as well. And the way I'm doing it here in this video, a lot of people would say, oh, you're using a lot of momentum. This is actually how the exercise was intended. If you actually go and look at Louis Simmons, who is the inventor of this from West Side Barbell, this is how they demonstrate the exercise being used. And if you do it in this manner where there's a little bit of momentum, sure, a little bit of swing in this pendulum, fair enough, as the legs come down, the low back muscles are having to fire really, really hard to decelerate against that lumbar flexion that's occurring as the legs come back down, and then also to power up. Now, by no means are the paraspinals the prime mover here. The glutes and the hamstrings are the prime movers. But in terms of the low back, spinal erectors are very, very active. If I had to choose between the reverse hyperextensions and the regular Roman chair hyperextensions, I'm going to go with the Roman chair. but sometimes it can be good to change things up a little bit. And I believe it was actually Louis Simmons who had a hurt disc in his low back from some of the things he was doing. He actually built the reverse hyper machine and rehabbed his own low back with it. And if you think about it, it actually kind of makes sense. One of the treatments that sometimes works for discogenic low back injuries is repeated extension. And yes, he probably had to control the flexion a little bit first once he was out of the acute phase, but you're going into that extension, and a lot of people respond really well to that. Not everybody, you have to test, but some people do. And for some individuals, this can be a really good exercise for that. Just start low weight and work your way up. The last exercise here is some type of row. And bent over rows are really the best way to do it, particularly a bent over row where you are hinged quite a bit forward. If you're way up like this, the low back muscles are not going to experience nearly the tension as if you were hinged forward. So if you look at this particular bent over row here, I'm staying low. My torso is not quite parallel to the floor, but it's near parallel to the floor. And as long as I stay down when I'm doing it, the low back muscles are having to stabilize immensely against excessive lumbar flexion as I'm doing the row. So that would be a good example of a type of row that'd be good for this, just a simple bent over row. You can do it as a T-bar attachment as I have right here. You can do it with a barbell, whatever floats your boat, but make sure to stay low. Another variant that you can use is a flexion-based row. And a flexion-based row ends a lot higher up, as you can see here. But as you go down into the hinge position, you do allow a bit of lumbar flexion. Not a Jefferson curl, not like that. Nothing of that sort. That's a mobility exercise for the low back. But you're allowing some lumbar flexion as you go down, and then as you row up, you stand up, but not quite all the way up, to keep tension on the low back muscles. And now the low back muscles not only are having to stabilize against excessive lumbar flexion as you go down, but they are contracting eccentrically on the way down and concentrically on the way up. And so this can be a great exercise to fry those lumbar paraspinal muscles. And don't forget, with any of these exercises, if you switch them to single leg or switch them to a staggered stance of some kind, you're going to elicit a lot more multifidus with it. You're still getting multifidus with it when you're doing the double leg version. But let's say I did a Roman chair hyperextension but did it single leg. Okay, I'm still working the glutes, I'm still working the hamstrings, I'm still working the gluteus medius and minimus on the working side. I'm still working the spinal erectors, but I'm getting more multifidus because I'm having to stabilize against that lumbar rotation that comes as a consequence of doing it in a single leg manner. So, lumbar paraspinals, don't neglect them. Don't neglect them in yourself. Don't neglect them in your patients with low back pain if you suspect that they may be weak. And a really good way to tell if they're weak is testing with a Sorensen hold. We'll be going over that more in a separate video, so keep an eye out for that. And then also just feeling the paraspinal musculature on their back. If there's really no split there on the spine and they're pretty atrophied, there's a good chance they need to get stronger and get those muscles bigger, as we saw in those other literature articles. So hopefully this video gave you a good understanding about how to strengthen these spinal erectors. Please make sure to like this video, subscribe to my channel, and hit that notification button for notifications for all videos in the future. Thank you so much.